All right, so we can jump onto the business of the day. Thank you very much, guys, for joining. Thank you for your patience. We apologize that the last 5 minutes we seemed a bit confused, but here we are. And yes, a part of taking care of our mental illnesses is not to freak out when such things happen. And here we are, ready to face the day. And this is Get It Right with Atara Solutions. My name is Grace Nzula. Grace Nzula is a HR consultant and trainer with Atara Solutions. You are tuned in to Get It Right with Atara Solutions. I am the host, of course, with my co-host, Kevin. Kevin, please introduce yourself.
And my name is Kevin Adipo. I work with Atara Solution as the HR, as a HR associate. Alongside, I'm here to represent the Facebook family. So kindly, for those of us who have people who don't have Zoom or in their phones or their laptops, they can log in through Facebook. You can share and share also with their colleagues. Thank you. Back to you, Grace.
Thank you very much, co-host Kevin. And of course, we have our sign language interpreter, Madam Catherine Sidandi. So Zoom has come up with an interpretation window, and that is what we are trying out tonight. And we are very excited. I hope the people who are talking about pinning Catherine and making sure that the sign language, our followers who use sign language are able to see her. I hope it's better today. I don't know. I can't see her, but Kevin can, so we are good. But nonetheless, we are happy to have you. This is Get It Right with Atara Solutions. It's a webinar series that seeks to demystify issues in employment and entrepreneurship. We are on season 4 of Get It Right with Atara Solutions. Season 1 was in 2020. Season 2 was in 2021. Season 3 was last year, and season 4 is this year. We happen to be the only people who have a season that runs for almost a whole year. And we move with the times. We are the official trendsetters, and we are grateful for the opportunity that has been accorded unto us. And we are grateful that you guys are able to join us now. For us to be able to run this every Tuesday, we have partnered with a number of organizations and allow us to give them a shout out this evening, because they have really, right now Zoom, if I told you how much Zoom is costing, for those of you who do these things, you know how much it is you pay for a Zoom webinar that can host about 1,000 people. And that is what we do, because we want to make sure that we are changing. We are on a mission to change the world through information, and we can only do that with our partners. So we have Stallion Construction Company. As the name spells it, construction. If you want a house put up, if you want to renovate your house, your office, if you want to subdivide your new office, if you want to make it small, I mean, the budgets are cut right now. The economy is a bit shaky. So if you want to reduce the size of your office, then Stallion Construction Company are your people. We have Pathway Solution Services. Pathway Solution Services are HR and training company as well. They are training on an LMS. LMS is Learning Management System. They have been part of us for a while now, and some of you have gotten a chance to train with Pathway Solution Services. We thank Frank, because I mean, he has really been with us. He has joined our journey to change the world through information, and he has been offering free trainings for our people, where you log on to their LMS, you get to learn by yourself, you do a test, you have a certificate given to you. So at the end of the day, you have something to prove that you have been trained. So that is what Pathway Solution Services does. And then we have HRMPEB. HRMPEB is the Human Resource Management Professional Examination Board. HRMPEB deal with, they're the official examiners for CHRP. CHRP is Certified Human Resource Professional. Certified Human Resource Professional. That is what CHRP stands for. And HRMPEB, if you're looking to do your CHRP, and if you're looking to get exempted, please make sure you get in touch with us, and we'll link you up with the HRMPEB for all your CHRP needs and any other courses that they offer. I think they're also examining diploma courses. And then we have Panessa Training Institute. If you're looking to become a carpenter, if you're looking to start to learn about woodworking, if you run a shop and you want to become more knowledgeable as you manage your carpentry shop, then Panessa Training Institute will be there for you. We actually have an intake starting on a Monday, so please run while we have an opportunity. And I promise you, it's worth your while. And then we have Weekly. WeClean is a carpet cleaning company. They have a machine that cleans carpets within 6 minutes. So they do 24-hour delivery. They pick up your carpet today, they'll bring it tomorrow. Even if when it's raining right now, you don't have to stay with a dirty carpet in your house because you're wondering, oh my God, what do I do? They also do sofa cleaning, and they also do thorough cleaning of your home. So you don't have to wonder whether somebody goes under your seats. They actually offer that as a service. And then we have Suluhu Mediation Center. If you want to become a certified professional mediator, please join Suluhu Mediation Center. They have courses that run online. They have Saturday classes. They also have an LMS session. They have virtual classes, and they have physical classes. I am a certified professional trainer with Suluhu, and I really, honestly, I enjoyed that class. It's one of my favorites. And then we have Profiles International. Profiles International deal with everything people. So they are the only people who offer Genos certified emotional intelligence coach. So if you want to become a coach in emotional intelligence, then Profiles International offer the Genos certified course. And then we have Kapula Mintito. Kapula Mintito sell coastal goods. If you're in Mombasa or in Nairobi, by the way, I'm in Mombasa from 15th to 19th. You can make your order with me and I'll be able to bring them for you. And you get to only pay for pickup from my office. Imagine, you save up on the others. Yeah, so they have the best mabuyus ever. And then we have El Samia. Last week I was at El Samia. My God, that place is just beautiful. Even if you're in Naivasha and you're wondering what to do with your day, please just go to El Samia. You can go to their museum. They'll give you a tour of the museum. They have a video that gives you the story of Elsa the lion. Elsa is actually a lion that had been adopted and taken care of. So El Samia is a beautiful, beautiful hotel in Naivasha. And then we have Papas. Papas is a technology company. If you're looking for an ERP system, then Papas have that for you. And then we have Steadfast Quality Management, Steadfast Quality Solutions. Steadfast Quality Solutions is a company located in Kampala, Uganda. They offer PR and HR consulting services, and this is run by our friend Herbert Zake. Herbert Zake has been our partner. Thank you so much, Herbert, for sharing our flyers. Thank you so much for also supporting us when you're looking for speakers from East Africa. You have a wide network, and we are very, very grateful for that. So Steadfast Quality Solutions for your HR and PR needs in Kampala, Uganda. And of course, we have an offer for you. So if you want to know what personality you are, I know most of you have no idea what you are, yeah? We have a model that is called DISC model. DISC is for dominance, influence, conscientiousness, and steadiness. Gosh, Kevin.
Sorry. Okay, as Grace was saying, we have we have something here for all of us, and it's at a discounted price. That is, if you want to know your personality, kindly reach out to us so that we can we can connect you with Profiles International. Profiles International will help you at least, on the very least, if you're in a managerial position, if you are a manager, or if you are in a position of influence within the organization, or even for those of us who are just staffs, you need to understand your personality. So the DISC model, stands for dominance, influence, and steadiness. The C is not very clear for my end, but Grace will help me out with that. So the discounted price is only coming at Kenya shillings 6,500. So if you'd wish to know your personality, kindly reach out to us, that is through grace@atarasolution.co.ke, so that we can link you up with Profiles International. Thank you, and back to you, Grace.
Thank you, Kevin. I have a sore throat that I think is training the more I talk. So, but nonetheless, so DISC, I know Marvin is on the call. I'm sure he has shared the details on DISC. Just get to know your personality, how your personality gels with the other people, and how the other people gel with you. and how to manage all these personalities, because they are beautiful, they are awesome. I've done my DISC assessment, and I will not tell you until you have done yours and tell me what you score. Then you can figure out. And my team, I know where all of them belong to, and we know what to give to who at what point. So it's an amazing thing. And of course, allow me to also take this opportunity to invite all of you for the HR Congress happening from the 15th to 19th in Mombasa. Please come. We are discussing sustainability, performance management in a hyper-accelerated work environment. So thank you very much. And allow me to quickly take this opportunity. We have eaten a lot of time, taken Kikuyu, Kamba, everything combined. We've taken a lot of time, so we apologize for the delay. I know we wasted 5 minutes, then with my cough, then we are here. Poleni sana, but at this point, Nancy, do you know every time we interact, I get to learn something new about mental health. I also get to understand, I know we have talked about the difference between mental illness and mental health, but last, I think about 4 weeks or 3 weeks ago, we hosted an expert in drug addiction. And I remember her saying that part of what we need to determine when you're dealing with addiction is whether it is a mental illness or actually just drug addiction, which was very new to me because I don't think I've looked at it from that angle. But we are very confused. I mean, every time you see someone, in fact, nowadays I'm like, okay, that could be a mental illness. But I don't know whether I'm too conscious about mental illnesses or I am not too conscious. I mean, this thing, please demystify it for us. Can you help us understand mental health? Because it's not even mental illness. My God, look at me. Tell us, Nancy.
That is exactly what we will do tonight. And it's going to be much more clearer through the presentation that I have prepared for you. But just to echo you, Grace, mental health is quite broad. And because it's quite broad, it involves us working with a lot of professionals. So every time you will learn something new. So you just need to know the ABCs to take care of yourself and to also assist somebody else. So without further ado, I want to share my screen and we proceed. Right. I had a class earlier, so I will try to adhere to the class instructions. There we are. So Kevin, you can let me know if we are all set. So my name is Nancy Wanjiro Kafiro, and I am a psychologist. I'm the founder, Hisia Psychology Consultant. And for me, what I do, it is a passion, it is a calling. And I have gone back to school, acquired the necessary skill, and I practice this on an everyday. And I love impacting people on the mental health journey, mental health knowledge, because every decision you make in life begins with your mind. The decisions are influenced by your thoughts. So Hisia I work with Hisia Psychology Consultants, which we embark on a multidisciplinary approach, and we specialize in a variety of psychology-based services, as I have put on that screen, and we will have our contacts at the end of this presentation. So our goal is to empower your personal life through individual therapy, couples therapy, family therapy, child therapy, adolescent therapy, and group therapy. So when we are talking about mental health, as Grace has said, it is a broad topic. So today we are going to look at understanding how mental health works, the causes of mental health challenges, the intervention strategies that are there, and how we need to break the stigma on mental health, because we do know very well that a lot of people are struggling with mental health problems because they are caught quite late after they have begun. But if we were able to intervene earlier, then we would help a lot of people. So I meant to have an interaction with all of you, and the questions on the screen are whether you experience periods of poor mental health. Do you think that you experience periods of poor mental health in your life? Just take a note. And when you're going through these periods, do you ask yourself whether you're the only one who feels that way? Is that a question that crosses your mind? Okay, because a lot of times when somebody is in distress, they think or they feel like that they are the only one going through that challenge. So I intend to answer this question, and maybe also yourself, you shall be able to answer it. So the basic definition of mental health that has been adapted by a lot of organizations is how it encompasses your emotional, your psychological, your social well-being. And what it will do is that it will influence your cognition, your perception, and behavior, okay? That is to mean that it will affect how you think, how you feel, and how you act. And it will determine how you handle stress, how you relate to other people, and the choices that you're making. Mental health goes hand in hand with well-being, okay? And well-being looks at high levels of positive functioning. So when you're mentally healthy, you have a high level of functioning, okay? So every person from childhood all the way to old age, they have importance. There is an importance of looking after your mental health. So we cannot just say this group, the working class, is the only one that struggles with mental health. And when we think about that, because we will see how different ages and the kind of conditions that they will have at that stage, and so that you are able to look out and direct them to the right help. But before we get there, what causes mental health? Okay. In addition to what we know, the biological condition, mental health is caused by some part of your brain not working well or working the wrong way. Okay. So every function begins at the mind. So when the mind or a part of the mind is not working well, it will affect your mental health. And what are the aspects that get disrupted? We have your emotional well-being. We have your thinking. We have your perception, the way your body receives and sends signals. And we have your physical well-being. There are those who will complain of muscle ache, backache, and then behaviorally, your reaction, your attitude, all those things indicate when when somebody is going through mental health. So mental illness. So mental illness ranges from mild to severe. So it's not in one class fits all. And that's why I said in the beginning, if we are able to arrest this thing early, we would be able to help a lot of people. All right. Moving on, we have factors that contribute to mental health conditions. So I had said we have biological factors, we have life experiences, and we have family history. So if that part of your brain at that particular time gets affected and you had biological predisposition, then this condition comes to life, okay? If that part of your brain gets activated and you're going through challenging life experiences like going through trauma and abusive relationship, then you will experience mental illness. And if that part of your brain is struggling and you have a family history on mental health problems, then you're most likely to have a pronounced increase or no appearance of the mental illness. So we need to look at the causes of poor mental health, besides just the biological factor, and thinking about also the brain not working. So if you have a child, or if you know somebody raising children and they are abusive, they neglect this child, or the child has experienced trauma, the likelihood of them struggling with mental illness later in life is very high. If you have been isolated or are going through loneliness, relationship breakup, when COVID happened, we had a lot of rise in the cases of mental illnesses. If you're experiencing discrimination or going through stigma, discrimination can be because of how you identify, It can be because of an illness that you have just come to know of, or it can be because of your background and maybe practices culturally. If you're experiencing these things, the likelihood of you to have a mental illness is quite high. And if you have social disadvantage like poverty, going through debt, having lost someone, experiencing long-term stress, okay? There are people who say, I am very resilient and I have a capacity to handle stress. So you continue sitting in an abusive or manipulative environment. So you're exposed to long-term stress. And we have people who maybe have looked for jobs outside the country, and maybe let's talk about the house helps or people who go look for jobs in the Arab countries, and you don't find the environment conducive, but you're unable to come back. That is exposure to long-term stress. The likelihood of a mental illness coming up is quite high. And then thinking about physical health condition, and unemployment, and I know HR, the demand for jobs right now is quite high. And a lot of people are choosing the kind of job they want to have, the income level they want to have. But if you cannot be able to adjust for those who are looking for jobs, then you will have a likelihood of experiencing mental illnesses. Looking at people who have poor housing, hopelessness, having a long-term career in one job, okay? Those people who are employed and they work 35, 40 years for the same employer, same role. At the end of the day, when they leave employment, when we are looking at the stages and the mental health conditions that come about, you will find that they have a lot of dissatisfaction and they experience mental illnesses and the rest that I have listed there. So all these are causes, and we can see some of them are unavoidable, some of them possible to avoid, and you can actually protect yourself. So how do we know when someone has poor mental health or they're experiencing poor mental health? This is now for you, Grace, when you say, sometimes you look at someone and you're like, is it an illness or what is it? So you'll hear them complaining or talking about how they are forgetful, they are unable to focus or be attentive, or they are not as quick as they always were before. So they're experiencing thinking difficulties, okay? That is one sign that this person is going through a state of overwhelm. Somebody who at one point will be very happy, at another they will have very low mood. So the variation in those moods, they are extreme. It is an indicator of a poor mental health. And then another one is sleep problem. Sleep is quite key, and it helps us to the cells to regenerate and even the mind to function better. So when you have sleep challenges, say you're not able to sleep throughout the night, you have interrupted sleep, or you find yourself sleeping too much, or even when you wake up, you're actually awake, but you're just there lying on the bed. You don't feel motivated. It is an indicator of poor mental health. In addition to inability to take care of yourself, self-grooming, and then changes in appetite, all right? But these are the major ones that I want us to focus on. So I did mention that there are stages and there are mental health conditions that come about in those stages. So you can see at the childhood stage, a child at some point will experience anxiety or go through depression or withdrawal. Some children will have attention deficit hyperactivity disorder. Another one would be autism spectrum disorder and behavioral disorders. Behavior, when you see someone with behaviors that are extreme and hurtful, it is important to call for the attention of a mental health practitioner, because they'll be able to help you diagnose that, all right? So these are the most common conditions that children would have. And this is because the primary challenge for a child is how they process their social and emotional development, okay? And how they learn to self-regulate, express those emotions, and grow their social skills, okay? If these are not nurtured, they will contribute to mental health issues. Children will also experience stress as you, as an adult, experience it. And this stress could be related to the family dynamic and academic performance or peer relationship. All right? So these are kids who haven't reached their teenage years. When we go to the adolescent stage, we do understand all the changes that are occurring. There is body changes, the mind is also growing, and they are learning how to interact and identify with their peers. The peer approval forms the biggest window that they view themselves, or mirror that the adolescent will view themselves. Now, around this time, the family, the parents have already gone through the whole cycle of, oh, the kids are cute and everything, and they are going through career growth. So most attention is on the career. And when there is an attention, one focuses so much on career, the relationship, husband, wife, or, you know, the relationship, mother to child, father to child, the relationship sort of takes a drift. And the teenager school academic is also quite demanding. So you might find that the kid, remember I talked about the things that trigger mental health as much as it is because the part of, there is a part of the brain that does not work well. So you find these teenagers will have onset of bipolar, they will have onset of schizophrenia, they will have panic disorders, they will have social anxiety, they will have addiction, they will experiment at that stage, they'll have obsessive compulsive disorder, they'll also experience eating disorders, that is the bulimia, anorexia, and not to forget that at this stage, we have a lot of them who are usually self-harming, cutting themselves, hurting themselves, you know, any form of self-harming. And they're usually doing this because they are going through distress. And they will also experience depression because of everything that is going on in their life. So you as a parent or as a caregiver, your work is to be very vigilant, and you look out and ensure that you have a healthy relationship with your teenager so that you can catch this early. A lot of bipolar diagnoses, schizophrenia diagnoses will happen later on when somebody is in their 30s, whereas it had begun quite early, all right? The screen is not moving. What do I do, Kevin? I can't hear you.
Try now.
Okay. Still.
Okay.
Maybe I stop share and share again.
Yeah.
Please.
All right. Right. So moving on to the next stage, which is adulthood. And as I mentioned, adulthood will have challenges of stress of daily life. That is work. So you're sort of in a sandwich, as much as a teenager would have been in the sandwich, you're the one who is most sandwiched because family responsibility from your parents, from your siblings is dependent on you at this stage, and you have your kids who you're raising, okay? Financial requirements with the changes in the economy, the demands are quite high. You experience significant life changes. This is marriage, remarriage, parenthood, and career changes. So what happens to the adult? They'll go through stress and they will experience a lot of anxiety. Remember, if the anxiety had not been managed, if they had not been taught coping skill in their teenage years, every time anxiety presents itself, you will realize it when it is on a higher note, higher level than it was before. Every time you experience depression, you will realize that you're going through depression because it is on a higher scale, okay? So they'll have this, and as I said, some diagnoses in the teenage years will be picked in adult age because they had not been picked then. Then the elderly, they'll have bipolar. And the elderly, we are thinking about your parents, those who are above 55, almost retiring or have retired. So there are those who will have bipolar and it will be diagnosed then. There are those who will have schizophrenia, panic disorder, social anxiety. They'll also experiment on addiction. A lot of people say, oh, I think my dad is going through midlife crisis because they are consuming too much. They're becoming addicted. Maybe obsessive compulsion and eating disorder. In addition, they will also have challenges with suicidality. Now, suicide is a topic, and when it happens, it really affects a lot of people. We say it will affect a total of 9 people if suicide happens in a family. So you can imagine for an older person having suicidal thoughts or actually taking their lives. There are those who die, and because mortem is not done, they actually have died out of suicide because of all the life changes that they have gone through, experiencing loneliness, going through widowhood. All these things can point and push someone to mental illness, okay? And we probably might assume. And remember, I told you some of the triggers would be how somebody's memory is working. How many of your parents or grandparents are struggling with their memory? And are you taking it for granted, thinking that, well, it happens for them, it happens to people around that age? Please have them get assessed by a mental health practitioner, because once you're done with them and you go back to your workplaces, Nairobi, Mombasa, out of the country, and you leave them alone, they actually will be going through a lot of stressors because they sometimes will think about their lives and what they have accomplished, what they have not accomplished, and all these things contribute to mental illness. But if well handled, and if there is room for celebration, they are going to have a healthy mind. So having talked about that, I'm sure all of you are like, oh my God, so what are you talking about? What do we do? Let me demystify. It's not all gloomy. As I told you, I enjoy this and it is fun. It is beautiful. So I like for people to understand that mental health is not what we call it. And when you see someone, you start labeling them. Well, we need to understand that anyone and everyone can get affected by mental health. In fact, there is the flu of mental health. The way you have a bacterial homa or a virus homa, there is also the flu of mental health. And the flu of mental health is an experience of anxiety or an experience of depression. And we all oscillate there, okay? And also that you're diagnosed with mental disorders, it is possible for you to live a positive and productive life. It is not a death sentence, okay? And how you're able to do this is having to work with your psychologist and your psychiatrist or your clinical psychologist. There are people who will have severe and persistent mental health disorders, and sometimes they struggle with responding to medical. So there are people who've come to me and said, oh, yeah, I was diagnosed with bipolar, but the medication I was receiving outside the country, it doesn't seem to be working for me. So you require to be patient and to allow the psychiatrist to give you different medication and it to take effect within your system. And then another thing we need to understand is that it ranges from mild to severe, all right? So I hope that makes you breathe a bit. So talking of mental health, there is good mental health. It's just not mental illness. And good mental health looks like what I have put on the screen. There are periods you will be happy. There are others you are going to be sad. There are periods you're going to be indifferent. There are periods you're going to be frustrated. There are periods that you're going to experience joy or you're going to experience love. And you can experience all this within a day. So you can be joyful because you received good news, or a spouse sent you something beautiful. You can be happy because you were told your kid performed well, or you got a job that you had pitched for. You can be frustrated because the messenger dropped the envelope in mud, and you can still be indifferent. And all these emotions help us to know that you have a functioning mind and you're able to pick up cues from your environment. So when you feel sad, please don't say, I have depression, okay? Just be out of that one situation. So once you understand that, mental health works in the like the pyramid on the screen. And you can see the pyramid has a base, and a lot of people exist on this base. A lot of people will have no distress. You remember the question whether you're the only one who is experiencing that problem when you're going through an illness or distress? It's because you're looking down at the majority of people and seeing that they are not going through distress, okay? Then we have a small number that has mental health distress. And once you move from distress, that's when you develop a mental health problem, okay? And when you move from a mental health problem, that's when you develop a disorder. So if your mental health distress if you're capable or able to address your mental health distress, then you will drop to the base. If you have a mental health problem and your psychologist helps you to identify it, or you go to your psychologist with the issue, then you will drop down to mental distress and back to a no distress at all. And if you have a mental health disorder, you can help, your therapist and your psychiatrist can help you manage it such that it is no longer, as much as it is labeled what it's labeled, it's no longer a big challenge. So you see it as a problem, and a problem has a solution. It is solvable, okay? So the arrow point for how mental health grows. And it is possible for you to be in either of those or in all of them at one time. How, you may ask? You might have been diagnosed with a condition such as bipolar or ADHD. So that would be a mental health disorder, okay? And then you lose someone close to you, okay? Loss of a relationship or loss in death. That would be a mental health problem, okay? And then you have a deadline with work, okay? So the deadline with work or an upcoming exam would be mental health distress. And then once you're able to solve your mental health problem, going over the loss, going over the job, you've submitted the job that had a deadline, you end up having no problem, forgetting it all. So it is possible for someone to exist in all this. And that's why we are here, so that we can help you know, okay, this is the disorder which we need to manage. This is the mental health problem that requires certain tools and interventions, okay? And this is the mental health distress. These are your triggers. And because you have these triggers, we are going to equip you with ways of dealing with them. And some of them would be, yes?
I don't know, I have seen Catherine saying your screen is not showing. We can see the screen. I don't know whether everyone else cannot see the screen. Please type YY if you can see the screen, just so that we can confirm whether it's Catherine and Avila's. Okay, yeah, it's visible. Okay, fine. Catherine, maybe you need to check your screen. We see a lot of YYs. Go ahead, Nancy.
All right, super. So as I said, it's possible to exist in all this, and without the knowledge of a professional, you will be classifying or labeling yourself in the wrong category. Okay. Moving on. When do you need to seek help or help somebody? Go look for us, for me, the psychologist. When you find them worrying more than usual, when you find them having challenges with enjoying life, when they are having thoughts and feelings that are difficult to cope with, and this can be catastrophizing thoughts, okay? There are people who feel like because of their appearance, everybody is noticing them. So they go through a lot of anxiety, and that makes them paralyzed, okay? So if you have somebody who's experiencing such, refer them to a psychologist. When somebody is interested to find support, because mental health, it becomes a challenge when it causes you as an individual a challenge, or it affects your environment. So you might have realized, and I'm sure the expert of addiction said that the addict sometimes can decide in the change program, they may decide to seek for help. It is their decision that helps impact their life. Similarly, somebody who has had mental health distress or mental health illness might feel that they want to get more support. When you're experiencing panic attacks, when you're experiencing psychosis, having suicidal feelings, or you're actually self-harming. How is
Nancy?
Yes?
There was a question on self-harming
Yes.
previously. Somebody had said, explain again on self-harming. There was a question, so I've seen it again, and I wanted to probably ask.
Okay. So for self-harming is causing an injury to yourself willingly. And we find that people who have emotional distress will do this. So they might cut themselves, could be on their arms, could be on their thighs, could be on their stomachs, areas that they are able to hide. And while they are doing this, or when they cut themselves, they experience some sort of relief, okay? But they do that because they are unable to deal with themselves, or they have experiences of guilt or hurt or anger. So, and they blame themselves. So they do that because they feel inadequate in a big sense. And there are those who will self-harm as a call for attention. And if you find somebody self-harming, it should not be taken lightly. They need to be heard. They need to feel not judged. They need to feel supported, all right? So how you respond to an individual who has been self-harming will help them open up, or it might cause them to close down, okay? I hope that answers it.
Yes, I think
Right.
we'll ask the questions as we finish.
All right.
Yes.
How do you, okay. Diagnosis of mental health, that is done by a psychologist or a psychiatrist. It is not you back at home because you have had a lot of information. Sometimes a lot of information will cause you to have infobesity, okay? The same way, if you overeat, you will have obesity. So leave it to the experts to do their jobs and to help categorize the illness in the right category. And then the therapist or the psychiatrist will ask questions. They will look at your moods, they will look at your thoughts, they will look at your behavior. There are times that they may have to involve family members to get more supportive information. But if you are capable and they have diagnosed that you're capable, then they will get all the information from you, and they will keep it private and confidential. So after you have gotten a diagnosis, you need to build a support system, okay? You need to have a system that understands you, appreciates you, knows you, and can be there for you, because your support system needs to be psychoeducated, given more information on that illness. For example, if you get a relative and they get diagnosed with cancer, when they don't communicate what they are going through, it's very hard to support them. But when you know what they are going through, you will even do research. If somebody has diabetes and they're coming to visit you, if they don't express that, I don't usually take ABCD because of diabetes, you will not offer them the right meals. But if they communicate, you will be interested to know, how can I be a good host for you? So similarly with mental health illnesses, you need to have a support system or a peer group. And then in your treatment, you need to participate in it. Your therapist will give you certain assignments. Your psychiatrist will give you medication. So you will need to participate. You'll need to take your medication as prescribed. You will need to diarize or jot down your mood journals or any other activity that you're given. Your participation helps us to be able to gauge the improvements you're making or where you're experiencing challenges, okay? And then having a recovery plan. And the recovery plan is mostly for people with addictive tendency, because addiction is a disorder in itself. So having a recovery plan that you're able to adhere to. So if I use the same example for diabetes, you know the kind of meals to avoid. So with the recovery plan, you also know the kind of things to avoid because you understand what your triggers are. What are the treatments for the mental illnesses? We have talk therapy, which will help you to cope with upsetting memories and improve relationships, develop more helpful ways to deal with your everyday life. Remember, I said that you can live a productive, you can even excel at what you do. So because you have these coping skills, a psychiatrist will give you antidepressants or antipsychotic, mood stabilizer, or sleeping pills. So all these are not weird. There are people who say, I don't want to see the psychiatrist because I don't want to be addicted or dependent on the medication. Those are the medications they probably will prescribe for you. And then there is art and music therapy. And if for the purposes of treatment, they need to be conducted by somebody who is a trained therapist, not just anyone. They need to know, it needs to be goal directed. And then looking after your physical health, because your physical health will aid your mental well-being, and also your sleep. As I said, sleep is quite important. So you try to get enough sleep, not less than 6 hours. Sawa. Higher. So having known that, if you're diagnosed, you need to have your community support you, not stigmatize you, all right? And you will be the first participant in breaking that stigma because you're involved in your treatment. And then talking about your experiences, all right? Without sharing your experiences, you actually suppress most emotions that needs to come to the surface. And then understanding your rights, maybe at work, the policies on health and all that, so that you don't step on people or use your condition as an excuse. So as I said, depression is not feeling sad. So we don't need to say, oh, because I'm sad today, I'm depressed. We need to use the right language. And also having ADHD is not the same as being hyper. You know, you can be hyper because of probably some food you took, you know. So all these conditions have to meet a certain criteria. All right. I talked of how good mental health looks like. Self-care tips. You need to stay aware of your mental health. Nourish your social life. Have social relationships. When Grace calls me her friend, I feel very nice because she forms part of my social life. Have peer support. Make time for therapeutic activities. Can you guys stop telling me that therapy is expensive? All of you need to come for an assessment. 224 people I'm expecting. Yes, because you spend on your hair, on your nail, on your, the barbers, on your car tires, and you don't make time for this. You need assessment, and it needs to happen twice a year. Look after your physical health. You're able to pay for gym or go for a walk, go hiking. You can have monthly physical activity goals. And then contacting a specialist organization like HISIA, having them on your database in case of anything. And then, as much as we love to enjoy life, I'm not saying you stop enjoying life, but avoid overconsumption of drugs and alcohol. Make time for personal care and eat healthily. Okay? That is HISIA, the services we offer, and our contact. And I will take the questions, Grace.
Nancy, you are such a, I don't know, every time I listen to you, it's just fantastic. You understand this subject, kabisa, kabisa, kabisa. By the way, you guys, there's a day I got dumped and I had to go and see Nancy. It was really bad. So, so don't take going to therapy like a joke. It is real, my friends.
Yes, yes, and you handle the distress quite well.
Yes,
Yeah.
yes. Anne Motito says what? Give us a quote for the therapy. My therapy, or whose therapy? Kwanda kabisa. And yeah, so Nancy, there's something you said about self-harm. And it got, I remembered something. A friend of mine, every time she has like, I don't know, she's covered her body in ink. Every time she's going through her face, she gets a tattoo. And it's subconscious. She actually, like a month after getting the tattoo is when, actually it's only recently that she's discovered every time she's going through something, she gets a tattoo. Is that part of self-harm, or is it part of what is that? Coping mechanism?
It's a coping mechanism, right? But coping mechanisms can be healthy and they can be harmful, right? A lot of people get tattoos because you have a scar that you're trying to hide. So I would be more curious to know whether the tattoo happens to cover a scar. If it is happening to cover a scar, a wound, an injury, then it is a problem.
No, she gets a new thing. Like she has ink on her legs, on her arms. I like.
Yes.
Yeah.
So I would be interested to find out more, the story behind what drives her to the tattoo before I qualify it. But if it is a coping mechanism needs to be regulated. Okay, they serve a need. But if, like now that she keeps getting the tattoos, does she like the tattoos? Do they affect her, the way she feels about herself? Does she regret the decisions? All those dynamics are ones that I'd love to look at. Okay.
All right. Yeah. And Anne is saying, please take us back to the slide on how good mental health look like. Anne. Okay, sawa.
Let's see if Hiya, back to the class again.
Yes. So as you figure that out, there's a question on dementia.
Yes.
Yes, we'll go back there. Let her share one slide first on.
So let me go to the slide, how good mental health looks like.
Yeah.
Is it that one?
Yes. You're saying the one with the emojis. There you go, Anne. Yeah. Quickly. And somebody else is asking for, please, may you share the services offered slide again?
Okay, no problem. So maybe just to touch base here, good mental health does not mean that you're just experiencing positive emotions, that you're just happy, Good mental health means that you're moving from one state of emotion to another without experiencing any hitch or any distraction. So you can be, you can get angry and you can get sad, but at the same time, move from those emotions to experiencing love, joy, happiness, feeling indifferent, but you're not stuck in any one. So that ability to move from those different emotions is what we call good mental health, because you're able to cope.
Okay, somebody said the services you offer.
Right, so I'm going there.
Okay, there you go. You can leave that there for a minute. Nancy, is dementia a mental illness disorder or is it genetic?
There are many ways to look at dementia. It is deterioration of the brain. So the brain is sort of like wearing out, and it's a neurological condition, okay? But it can be supported. If it is picked early, the neurologist will be able to help you with intervention, and they might send you to a therapist because they've listed the intervention and the support strategy so that the family can be supported. And also for you guys to understand the red flags when the levels start to go up. So that is in the medical field, and I'd wish we would get a neurologist to break it down.
Okay. And Jacqueline is saying, how can employers incorporate mental health awareness in the workplace? Or rather, how can they support?
Wow, because employers are broad, activities like team building would help guys to open up and bond more, because remember, having a social connection contributes to a positive mental health. And then if there are individuals who are struggling with addiction or any other challenges, having experienced loss, or going through difficulties in relationship, being directed to a mental health practitioner. If somebody has been diagnosed with a mood disorder, them being given the support that they require at that particular time. And then in periods where an individual has gone through burnout. Burnout is when you have gone through a lot of anxiety, a lot of depression, and it becomes a cycle until your brain or your body can't take it anymore. Being allowed to take some days off, okay? And these days we have a flexible work culture when you're allowed to work from home remotely and sometimes work from the office, which helps individuals to integrate their life with work, okay? So those are some of the ways employers can support. But the biggest burden on mental health is your individual uptake on it. How seriously do you take your mental health? Because if you enter your work at 8 a.m., work all the way till 10 p.m., then decide to pass by the joint, get a drink and reach home at 2 p.m. and tomorrow morning you're needed to go to work, it means that you're not prioritizing your mental health or your mental well-being. So the biggest responsibility lies with you as an individual.
I didn't get that. Could you?
Kevin, do you have any other question on YouTube, on Facebook?
On Facebook, apparently no, but there is a question from Francis Odro that has just come in. Is self-assessment unacceptable for mental health diagnosis?
It's not unacceptable because we have ready resources online that you can take. My question is, once you have done the assessment, what is the goal, or what is the next step that you take? I do get a lot of people who come and say, I have anxiety, and they actually will give you what the, GAD profile states. And, we have to go beyond that self-assessment, because mental health conditions or distress will be very pronounced within 2 weeks of experiencing that distress. So if during those 2 weeks is when you have conducted that self-assessment and you come to me and you tell me this is it, well, I will take it because you're the one experiencing it, but I will help you to dig deeper to understand. Remember the hierarchy on the pyramid to understand, is it a distress? Is it an illness? Is it a, what is it? And what is the underlying condition? Because most mental health illnesses come with they come with other illnesses. So somebody who has bipolar might have bipolar and depression, okay? So if we just target or treat bipolar, the psychiatric intervention, without giving them psychological interventions of depression, then they will always be in that loop. So you can self-assess if you feel like, but your therapist will go deeper on that matter.
There's another question on self-assessment of bipolar. I guess
yes, and mood disorders are quite tricky, okay? Because as I said, if you can talk of bipolar, then when you come to me, we go through it and figure out you don't actually meet all the criteria for the bipolar. So probably you have borderline personality disorder because you're experiencing shifting moods that are lasting, maybe 2 moods. You're happy at one point, sad at another point, within a day, in multiple times. That's not bipolar. You understand? So that's where a therapist comes in.
Right.
Okay, just before we got past the bipolar stage, how do people who live with this, or rather even employees who have employers who have such employees, help them manage these situations at workplace, or even for those who are living with them at their homes?
Yeah. It's important to talk about it. So once you have the diagnosis, try and learn as much as you can from your therapist and disclose with your environment, your HR or your department or your employer. Because once you have disclosed, they then will understand that you require support, okay? That when you're unable to, say, deliver on a deadline, okay, it's because you're going through probably a dip, okay? But when you're highly functioning, we probably can be able to tap on that productivity, okay? So employers can work with you only when you're open, okay? And employers need to be open to understand, because everyone is prone to a mental health condition or illness. Employers need to be open to accommodating anyone within their organization who has an illness. So we don't need to start hearing of discrimination or pushing them or saying, oh, they're using the tags. How have you journeyed with this person? Because at one point they were productive, or they will end up being useful for you.
Oh,
okay.
Yeah.
There's another question here. Okay, there are 2 questions. One is PMS. At times, some ladies get strongly affected mentally when about to have their periods, always crying, overeating, suicidal feelings of unworthiness. Can this be categorized as mental illness?
It can be categorized there, but it will require medical intervention and psychological support at the same time, okay? And it's not everybody who will go through those that extreme distress or disruption, but when it happens and you're able to navigate it with the help of your therapist or your psychiatrist, then you're able to regulate and come out of that stage. So it's no longer a life condition.
Okay, and right, it's Mental Health Month. You guys are going to learn mental health this month. You have no idea.
Yes, the best be ready.
Oh yes, actually the next couple of weeks, we have next week, we are looking at risk and the way we have inertia or afraid of taking risk. That is not mental health. We just thought, let's plug this one in before we kill people by mental health discussions. But then after that, we're also doing managing mental health in the workplace. And after that, we are also hoping to host somebody who actually suffers mental health, mental illnesses. So that at least they can explain from where they sit, what do they experience, what do they feel, how difficult or how easy is it, are they aware, all these things. We are looking forward to that. And in the interest of the number of people who have been passing on in the last couple of days, I think in June we are going to also cover grief. We talked about grief in season, I think 2 or 3.
Yeah.
But we talked about grief, I think from the management point for ourselves, yeah? I think we talked about it from the workplace end. So we're going to now flip the coin and see the other side, because yeah, things are really happening. But Susan Atinga says, is schizophrenia a mental illness or disorder?
Back to my pyramid, I would like to go there. For Susan, it is a mental health disorder. Okay. Just to answer her.
Okay. And someone else is saying, with childhood depression, can it reoccur in adulthood?
Yes, if not managed, if you don't get coping skills, it will reoccur. As I mentioned, depression and anxiety are the flu of mental health. So at one point you sink in and get out, sink in and get out. But when you realize this is happening all too much, you require to get coping skills. Depression has also a scale. So depression can be mild, it can be moderate, it can be severe, okay? So if you had moderate depression as a child, and then you go through a similar life experience as an adult, then yes, because your system knows how to respond to the distress that way, it can reoccur. So the idea here is to be equipped with coping skills.
All right, Kevin, I have seen you have goodies from Pathway Solutions. Please tell us what's on offer.
Thank you. Before then, allow me to ask these 2 questions. I'd seen them, and can one harm themselves subconsciously? And the second question is, this is from Susan Atinga. What is schizophrenia, and is it connected to mental health? And if it's connected, how is it connected? If you may just expound on that, please.
All right. Self-harm is a decision you make. Now, I don't want to classify it as conscious or unconscious, but it is a decision, it is a response to the distress. Okay.
In fact, Nancy, as you explained that, there's a question on what is the solution for self-harming. Maybe you can combine them.
Therapeutic intervention is the solution, because the psychologist, the therapist, journeys with a person who is actually self-harming. Okay. So it is a decision you make as a response to the challenge you're going through. So you could say, I'm overwhelmed with anger. So all I was thinking about is the anger. So when the person is self-harming, they most probably will not even feel the pain at that time. They will feel it after. Okay. That's when they'll go, oh, I did this. You understand? But it's because they are overwhelmed. Okay. And yes, schizophrenia is a mental health illness. It's a mental health disorder. And it is characterized with psychosis. And we have a lot of people who have schizophrenia and self-medicate. The earliest signs of knowing that you have schizophrenia is when you find somebody inclining towards substance use, okay? Because they are usually trying to numb the experiences they are having. So somebody with schizophrenia you might think they are playing pretend. You know the way we used to play cha mama, cha baba, and sometimes you're talking to yourself. You're being the mama, you're being the baba. So someone with schizophrenia would, at some points, be talking to themselves. They have beliefs that they have supernatural abilities, like they talk to God. They can dictate how what is going to happen. It's going to rain, and they'll have a good argument around that. It is a mental health disorder, and to the biggest extreme, you find a lot of people will be those who walk on the street. They are tattered. They have tattered clothes, or they are naked, and to them they are okay. They don't have a problem. You are the one who is seeing like they have a problem. So their mind is not functioning well. And sometimes they are aggressive because they feel judged, okay? And they feel like we cannot relate with each other. So it is a mental health disorder. And when somebody has been diagnosed with it, they will always have to journey with a psychiatrist and a psychologist.
Wow.
How can someone handle a child with mental health? They need to go and see Nancy.
Karibuni. Yes, but maybe with children, I need to just reiterate there. You need to observe their moods, okay? You need to observe their motivation levels, their cognitive abilities, okay? So if you notice some of those are off, then there is a challenge. You might notice that the child is lying. I've seen somebody was talking about someone lying. Someone can be a pathological liar. Behaviorally, they are also quite aggressive, or they harm people. So some of those things would be what indicates that the child is going through mental health distress. And children can go through distress without you knowing, because probably you leave them in the care of other people who take advantage of them, and they are unable to voice it out. So once you notice that, you notice the child has already passed the age of bedwetting, and they've gone back to bedwetting. They are showing signs of fear, or being too introverted, okay? Their personality or demeanor has shifted. You might need to have them assessed by a mental health practitioner. Schools would be good avenue to give you feedback on how the child is behaving, or around their peers, and similarly yourself observing, okay?
All right. I think we missed out on that question I saw you picked it, and I've forgotten now.
The lying.
The lying, yeah. How do I help a friend who is always lying to keep up
Yeah.
appearance among his people? What condition can this be? What condition is that though?
Wow. If somebody is lying to keep up appearance, they have challenges with their self-esteem or inferiority complex. So it is by talking about their experiences, their hopes, their ambitions with the next part that they are helped to align their abilities and their state, their level, the state of life, so that you can, first of all, be authentic, okay? And once you're authentic, you can take on challenges. Once you're authentic, you know what your capabilities are, and you position yourself in the right opportunities. But if you keep trying to be like someone, you miss out on opportunities that you are better placed for.
That's right.
Yeah.
And the last question. When someone starts to isolate themselves, trying to exclude themselves in many activities that they were doing, could they be a case of mental disorder? Can I answer that?
Yes, please.
Yeah, no, go ahead.
All right. So alone time is important. There are people who, depending on your personality, okay, your work, or you can be conditioned to become accommodating, but your natural predisposition is that you're an introvert. So you function best when you're alone. So we will need to understand whether this is you trying to gain back or refuel or re-energize, okay? When it becomes prolonged, you find this person is not coming out to eat, they are having challenges with sleeping, self-grooming, okay? Their mood is changing, then that's when we would direct them to a mental health practitioner. But we cannot at that time label it as a mental health problem. They are going through a shift. Remember, the mental distress they probably are going through mental distress or experiencing a mental health problem, and it's not qualified yet as a disorder. So just observe, and people will direct you to what they want. Yeah. When I talked about grief, I said when someone is experiencing grief, you don't give them the support you think they want. You ask them how you should help. So similarly, someone who is struggling will tell you, I need some time. In relationships, maybe let me mention it here. In relationships, you might want an answer there and then, and your spouse or your partner is not capable to express themselves at that time. So if they ask for time, please give them some time, okay? So that time, we shouldn't look at it as isolating. It is that time that they need to actually gather their resources to be authentic and genuine with you, okay?
All right. And I think this one, if we've missed this one, it's going to not be good. Returning to work after postnatal depression.
Yeah.
How do you do that?
Wow, postnatal depression happens to every woman within the past 2 years. So at one point, you will go through it. It could be immediately after you give birth. It could be after some time, after you've gotten the baby, all right? And what it means, once you have had a child, it means that you have to adjust. And the child can be alive, or it could have been even a miscarriage, you know, because there are people who go through losses, but you will have postnatal depression. So what you need to work with, or with your therapist or with your support group, peers, is adjusting to the changes you find, because you were out of work for some time. And they may have introduced systems. I don't know. Me, I always found my workplaces, they had always introduced something while I was away. So when I go back, I'm like, how do I catch up with this? You know, be patient with yourself, give yourself grace. I work hand in hand with your colleagues. If you're a leader and you had left someone in charge, when you come back, allow them to walk you through what has been happening. That way, you are able to gel easier through work.
Lest I
Excellent.
forget before Grace asks the next question, we have goodies from Pathway Solution Services. Today, to our today viewers, both online, that is on Zoom and on Facebook, we have 4 people who will get a free LMS training on health and wellness at workplace. This LMS training, learning management system, that is, you as the beneficiary will get it, or rather will go through it within your own time. So kindly write an email to frank@pathwaysolutionsservices.co.ke or grace@atarasolutions.co.ke. I think for Frank it's UK, not KE. I've shared it on the chat. And for the Facebook as well, I've shared it on the chat, so that at least on the very least, if you come out with nothing, at least you should come out with this training. But don't forget what Nancy has taken us through this evening. Back to you, Nancy and Grace.
Awesome.
Thank you so much, Frank, for the offer. Thank you so much. Please make sure you copy myself and Frank. If you don't copy any of us, unfortunately, you don't get that. And yes, I like the comment by Magina. Says postnatal depression is best handled by professionals because co-workers may not assist as much. So if you have depression, please make sure that you visit Hisia. Hisia is where Nancy is the CEO. Please make sure that you visit them. And in case you need any support in reaching them, I am here to help. And I will be happy to share their contacts. I'm a client and a friend of Nancy, so yeah, we're there. But yeah, so right, allow us at this point to just say, I think we can never finish these questions on mental illnesses, but at this point, allow us to say this. This is the Mental Health Month. Please make sure that you ask a colleague, a friend, a relative, Just find out how they are doing, how they are coping with issues, and ask them whether they need support, and refer them to places where they are able to get support. We have done a lot of mental health. Please go to our YouTube channel and get to learn more on what you can do. I think this is the 4th time we are hosting Nancy. We have hosted what do we call alcohol and substance abuse. We have even talked about men, man up, we have done quite a lot on mental illnesses, and we wish to continue doing so. So please, in case you have any query on mental health and mental illnesses and awareness, please get in touch with us, or just go to our YouTube channel and get to catch up on what is there. For those of you who are asking about this recording, yes, we are going to share it on our YouTube channel. We'll upload it there. It's Get It Right with Atara Solutions. Jacinta has shared the link. Please subscribe to that channel so that you can get updated when we upload the recording, which will be done probably by end of day tomorrow. Not tomorrow, that's
Grace,
yes.
sorry, I think I might be forgetting something that is again an offer from Pathway Solutions. For those of us who feel like they need any other training from Pathway Solution, as long as you mention Atara Solution or Grace, you are going to have an offer of 25% discount of the original price. And just on today's training, due to competition, kindly apply and justify on why you need such a training, again, for just to give us the seriousness of why you need the training. We would really appreciate that. So it's going to be on the it's going to be on the first come first serve basis. So the faster you justify and share with us that email, the easier it is going for us to get back to you. Back to you, Grace.
All right. Thank you very much, Frank. We thank you for partnering with us. Thank you for offering the sessions. And I like we are coming to you, Nancy, for the parting shot. But Karen is saying, Karen, good evening. I'm here with Mwenda, by the way, just so you know. Karen is saying, let's treat people well. You never know what they are going through. And I agree with that. I mean, people are fighting battles you never know about. And don't label people, eh? Yeah, so Nancy, give us your parting shot.
Right. So I want to appreciate the opportunity and emphasize that everybody is tasked or required to have their mental well-being at a good balance. Okay. And if you feel that you're going through any struggle, please reach out to a psychologist. I've seen somebody saying that it should be handled confidentially. And yes, we handle mental health issues and individuals who come for therapy confidentially. But we encourage you, if you have a diagnosis, the diagnosis should help you to be able to better understand your condition, not to label you. So you will need to engage your environment. And that means that you will have to share something about yourself. So I'm happy that Atara is doing this mental health awareness, and we are here to offer you the support. This session has been quite informative, and I'm glad to have impacted everybody with the knowledge. Asante.
Absolutely. Thank you very much, Nancy. Kevin, you have something?
As I have a friend here in Facebook who has mentioned, this has come in timely. As the start of this month of May, it's it being a mental awareness week again around the corner. We need to share more, get to learn more from others. And as one of us has mentioned, let's not use others' information to go against them. In short, backbiting and such forth. You never know what they're going through. Let's be all ambassadors of peace. Back to you, Grace.
Thank you so much, Kevin. We shall seek to be ambassadors. And thank you. Frank, thank you. Sign off. Saim Off. I think Saim Off said he's tuned in from, I can't remember, I think Tanzania. And thank you. He's actually prayed in the name of the Father, Son, and the Spirit. Thank you so much. So please make sure you follow us on Instagram. We are Atara Solutions. Like our Facebook page, we are again Atara Solutions. Follow, or rather, we are followed. Subscribe to our YouTube channel, Get It Right with Atara Solutions, and join our WhatsApp group. I think the link has been shared. If you missed it out, Jacinta, please share the link to the WhatsApp group now. So thank you very much, Anne, for that comment. We appreciate. Yes, we seek to demystify issues in employment and entrepreneurship, and we are on a mission to change the world through information. So I hope that you can go and spread the word and just help somebody, especially in this month that we are focusing on creating awareness. Please join our Facebook, or rather our WhatsApp group. Sorry. Join our WhatsApp group, and you'll get to know what's coming up on Atara Solutions. And of course, we will upload the recording for this session on our YouTube channel. And please follow us on Facebook and Instagram and get to know what's happening. What's happening now. We rarely share notes because we do a recording. They are actually, when you upload the recording, the notes were shared. You can listen as you check, because then you are able to balance and get the meaning of what was being explained. I keep saying that PowerPoint are normally points. They'll not give you the context. So you need to also get the context so that you can be able to apply. So we say, because we have recorded this session, as we share that and the screens were shared, please go listen in and take your own notes, and then you can translate that, rather than just us sending you a presentation that you cannot even remember. And chances are you're going to share with somebody who did not tune in, and then they are lost. And then they start saying Kevin has a mental illness, and Kevin is right. So allow us to just share that, and then you can, in case of anything, please just reach out. Get in touch with Nancy at Hisia Psychology. They are on Twitter. They do something on Twitter every week. Please check out Hisia Psychology, and also their Instagram page is pretty active. I think they are after millennials. The technology has agreed. But other than that, thank you our partners. Stallion Construction Company Limited, HRM PEB, Profiles International. By the way, don't forget to do your DISC assessment. And then Panessa Training Institute, Weekly, Suluhu Mediation Center, Elsa Mea, Steadfast Quality Solutions, Kaplamin Tito, Purpose, Pathway Solutions, and Weekly. Thank you so much, guys, for supporting us and allowing us to also share this with people, because if it weren't for you, I do not think that we'll be able to sustain this, actually. So we appreciate you very much. Thank you very much, Kevin, of course. And thank you very much, Catherine Sidandi, our sign language interpreter. You girl, you're amazing. You are a blessing to us. And of course, Nancy, we appreciate you. It's always a pleasure hosting you. And I hope that you continue supporting people and bring out the best in them, and so that they can be able to manage these situations as we go along. So thank you, guys, and have yourselves a lovely, lovely night.